My name is Teabalvi, and today I'm going to talk to you about aspirin. So, what is aspirin? Acetylsalicylic acid, also known as aspirin, is an over-the-counter medication used as a pain reliever. It consists of carbon, hydrogen, and oxygen, with its molecular formula being C9H8O4. As seen in this image, you can see that there's an acid group in the structure of aspirin, hence the acid part of the name. Acetylsalicylic acid. So how does aspirin work? I think in order for us to understand how aspirin works, first we need to understand the science of pain. If you damage your cells, you cause them to release a chemical known as arachidonic acid. This omega-6 fatty acid is found in the phospholipids inside the cell membrane. And when the cells are damaged, this chemical is released. There are then these two enzymes, which are commonly referred to as COX-1 and COX-2. And these enzymes bind with the arachidonic acid. When these components are combined together, they create a compound called prostaglandin H2. This would then be converted into other substances, which could increase the body temperature, increase inflammation, and lower the pain threshold, which is a person's tolerance for pain. Enzymes COX-1 and COX-2 both have an active site for arachidonic acid, and aspirin takes advantage of that active site. Aspirin will sit in the active site of COX-1 and COX-2 and then break part of itself off, and now aspirin is stuck on the active site, which permanently deactivates the enzymes. So, when arachidonic acid tries to bind with the enzymes, it is blocked by aspirin sitting on its active site, which is an example of inhibition. And since the acid can't bind with the enzymes, the reactions previously mentioned can no longer occur, which means symptoms like high body temperature and inflammation will no longer occur, which reduces pain. And that is how aspirin works as a pain reliever. If you overdose, you may destroy too many prostaglandins, which is dangerous. Prostaglandins have other important purposes in the body, such as protecting the stomach. If someone was to overdose on aspirin, they may destroy too many prostaglandins, which could result in damage to the stomach and lead to disorders such as ulcers. Now, how much does aspirin cost? The general cost for aspirin is around $10, and each tablet contains 81 milligrams of aspirin. Now, who should and shouldn't take aspirin? This medication really isn't recommended for children as they face the risk of stomach bleeding. It is also not meant for patients who are allergic to the drug. This medicine is really recommended for adults facing inflammation, mild pain, or for heart patients. Aspirin will act as a blood thinner, which will reduce the clotting in the blood. If you need aspirin and don't take it, especially at an old age, you are at higher risk for blood clotting, which could lead to heart stroke or heart attack. However, reducing the blood's ability to clot may cause some form of internal bleeding. And this is why it is important to speak with the doctor first so they can determine the dosage you need to help your situation. So, why is aspirin important? At the end of the day, if you are feeling some pain, feeling some inflammation, or if you are a heart patient, then aspirin could potentially save your life. In Canada, as of 2020, 5.3 million adults take aspirin. The main purpose is usually to avoid dangerous scenarios, such as stroke or heart disease. And 2.4 million of those doses are being taken without the doctor's guidance. And with so many unsupervised doses, it's no wonder why there are so many deaths from aspirin. In 2017, around 3,000 people had died from taking aspirin. So always remember, even though aspirin is an over-the-counter drug, it's always important to consolidate with your healthcare professional to determine the dosage you need to help you. With that being said, thank you for watching this video. I hope you learned something new and useful. Take care.